The Urgent Primary Care Centre programme set out to design a new model of care to respond to those with an urgent primary care need within 8 hours of contacting their local service. The aim was to provide seamless care, ensuring service users have access to the right care, first time, locally in line with national policy. 3 models of delivery have developed according to local needs, the workforce and the services already in place. A framework of what a good national model should look like has emerged with 6 interconnected principles. We will hear from each of the sites who took part across Wales as they introduce a principle each.
Throughout the programme, engagements with other stakeholders to establish trusted relationships and agree communication links between services were vital to the success of the centres. An immediate priority was the need for a clear and simple definition of urgent primary care centres, with inclusion and exclusion criteria evolving as the programme matured. Patient access routes into centres need to be clear for all professionals, with defined pathways into other existing services utilising the available IT resources.
A mixed workforce of multi-professional roles is the benchmark for efficiency and excellent patient care. As well as GPs, sessions are delivered by ANPs, pharmacists, physios, and in some cases, mental health specialists, all supported by non-clinical staff. Skilled local champions working collectively have delivered a suite of tools and resources to share national learning and good practice. All this has delivered a national programme based on new ways of working with innovation, quality and safety at its core.
The right workforce is integral for the patient. Collaborative working with community pharmacies, ED, MIU, out of hours and GP practices ensure patients with primary care conditions are seen within the appropriate setting by the appropriate clinician. It allows us to think differently about workforce, for example, recruitment into portfolio roles, which provides cover across a variety of roles. It also provides a basis of support, training and supervision for all staff, which enables them to work to their maximum level of competency, supporting retention and development.
Programme ambition is to offer consistent triage and signposting over a 24-hour period, 365 days of the year. Early identification of clinical needs by a doctor, nurse or advanced healthcare professional ensures patients are clinically risk assessed within 8 hours. Clinical triage is carried out by the multi-professional team, which ensures the patient needs are quickly assessed. This allows patients to have the most appropriate treatment via a suitable pathway, either at home or as close to home as possible, maximising local technology.
The challenge is to provide fair and equitable access to the whole population regardless of geography, with the person at the core of the service and at the heart of everything we do. Outcomes for all consultations were recorded and reported. Nationally, we set ourselves a standard of 75% or more for the outcome, self-care and/or prescription to measure our efficacy. We developed a national survey, a national patient satisfaction survey, to understand what people thought of the service, and use the learning and reported outcomes to review and refine our services to ensure a positive patient experience.
Locally, sites worked with stakeholders to understand the portfolio of existing services to complement, align and avoid duplication with others. Working across the health boards and primary care landscape, sites created urgent primary care capacity to support GP practice resilience and sustainability. By engaging with the wider system, sites were able to support and reduce pressure on the other partners, especially during peak pressure periods. As the service continues to grow, pathways have developed with the emergency departments, minor injuries units, paramedics, community nursing colleagues and others to provide an integrated offer.
So in conclusion, this framework has been developed and adapted for NHS Wales using each of the principles and supporting components in the planning and delivery of local urgent primary care services. The challenge is to take our learning from the national programme, using the framework described, to transform services to provide a positive patient experience. Utilising appropriate signposting and skilled workforce, we can achieve the right care in the right place first time. But let's not stop here. Let's think where this could take us in progressing towards a fully integrated service 24/7.